Exam link 2. Analyzing radionuclide images. The given figure shows the images formed by radionuclide imaging of the kidneys of a patient. It is given in the question that the right kidney appears whiter, and it must have a lower intake of the tracer and hence eventually emit less gamma radiation. 5. Comparing radionuclide and X-ray images. Radionuclide images produce 2D images as X-rays imaging does, so both belong to planar imaging. A. Health risk. In fact, as gamma radiation and X-rays are both ionizing radiations with similar frequencies, the health issues that they brought about should be similar. However, as radionuclides stay inside the patient's body for a longer time than a normal X-ray scan, the risk of excess exposure is larger for radionuclide imaging, and hence it has a higher health risk. B. Information provided. X-ray images have higher resolution, and so the images are sharper. Radionuclides as tracer can provide functional information about the target organ. C. Uses. Radionuclide imaging may provide the functional information of the target organ, and so it can find the severity of diseases and even identify diseases at an early stage. X-ray imaging, on the other hand, provides detailed structural information of the organs due to its higher resolution in image formation. And that is one of the reasons why X-ray imaging is still commonly used for bones and chest examination. The following table compares radionuclide imaging with X-ray imaging. 6. Effective dose in diagnostic procedures. Effective dose is a measure of the health effects that might occur after receiving radiation. Its unit is Sievert SV, which we have come across in Book 5. The table on the next page lists the effective dose of various organs when different imaging procedures are used. As expected, CT scan produces the highest effective dose, as it is just like multiple X-ray pictures were taken. In fact, the effective dose of X-ray imaging is the lowest in most cases. No wonder it is the most common first-line investigation for bones and chest examination. 7. Health risks of ionizing radiation and safety precautions. A. Biological effects of high doses of ionizing radiation. Both excess or prolonged exposure of radiation produce serious damage to living cells, as ionizing radiation may break down molecules and initiate chemical changes inside a living cell. 1. Early biological effects. Radiation sickness includes internal bleeding of organs such as the brain or the intestines, damage to the skin similar to burns due to high energy of EM radiation, or shutdown of immune system that lead to subsequent infections. These are all fatal, and most victims die of these early effects. 2. Late biological effects. Victims who do not die of those early effects may suffer from the following late biological effects: developing various cancers, damage to genes, or developing cataracts. B. Radiation during pregnancy. Under active cell division and various other cellular activities, a fetus is most vulnerable to radiation attack. The effect can be immediate, and some effects emerge many years after the baby is born. Abnormality and cancer are common in these cases. 6. Safety precautions. To minimize the risk of radiation exposure in medical imaging, the following are main concerns. First, pregnant women should avoid unnecessary radiation examination, which also explains why ultrasound scanning is used to examine fetus, even though its resolution is not high. And in those cases where clear images are necessary, endoscope is used. In addition, the time of exposure should be kept minimum. 2. Keep away from radiation sources. Lateral radiation sources continue their decay all around the clock. The radiation goes in all directions, and so received dosage obey inverse square law. When the distance doubles, the dosage decreases by 75%. 3. Shielding. Shielding is always a good idea. Lead shield, water, and concrete walls are often used as barrier for ionizing radiation. 4. Containment. Radioactive sources should be stored and be kept away from human beings to minimize unnecessary exposure to radiation. Do check point 6 on the next page. That's the end of the book. I hope you'll find the contents interesting, useful, and easy to manage. Good luck to your DSE examination. Thank you.